Reggie?
Oh, okay. So can you hear me?
Yes.
Okay. So I am wondering if AB 1400 or single payer goes through, does that mean, can we get rid of Covered California? Because I kind of find their employees pretty rude and they really seem very insensitive. They seem like they don't know about healthcare. They just seem like they seem like the seasonal salespeople that you hire during Christmas.
Sadly, I think Covered California does have far too many that are just salespeople. They got a tremendous budget to go and recruit people to sign up. They were paying tons of money to organizations like Equality California and others to go get their members to sign up, and they were incentivized to do so. They spent a ton of money on promotional items and commercials and things, but I don't think they spent a lot of money on customer satisfaction. The reality is, though, all of that money that was spent on ridiculous marketing and trying to basically pay people to recruit people, that's money that could actually be spent on actual patient care. That's the money that could actually be spent on pharmaceuticals. So yes, that would all go away under a single payer plan.
Shige.
Dr. Sung, you sounded like a pretty critical of Democrat. Are you saying that most of the Republicans are for it?
No, sir, not at all. What I mean by that is we know where the Republicans stand. I will say they're all about limited government, personal responsibility. They require work requirements to get Medi-Cal. I have no qualms. I mean, I vehemently disagree with them, but at least I feel they're being honest in terms of where they stand. My concern is the Democrats who keep saying we're for the people, we're for universal health care. And then time and time again, when we put them back in power and they have the control, they don't pass the legislation that ultimately can help us. Then they, on one hand, they say it. The only time they say that they're for something is when they know it has no chance of passing. But then once they become the ruling majority, then you see their true colors come out. Whereas for at least Republicans, they're opposed to this from day one. They don't waffle on that. While I disagree with them, I would rather have people tell me the truth about how they really vote on this than give us false promises. And we've had far too many Democrats who, Gavin Newsom said that he would make single payer a top priority during his administration. And for the first 2.5 years, 3 years of his term, he is not. He's put it on the back burner. He has appointed anti-single payer advocates and policy people to his healthcare commission. So, that's a prime example of somebody who said that they would do it, but when they got into power, they didn't. And that's really what I mean by that. Not that, but it's just that they don't follow what their promises are. Whereas Republicans from day one, that if you elect them, they're never going to let this happen.
Thank you.
Thank you, Shige. Reggie, do you still have your hand up?
Yeah. Actually, yeah, a couple of things. One is, I want to call out the dental industry because I do have friends that do work in the dental industry. They work in dental offices. They work full time. They work long hours, and they do not get benefits. I really want this AB 1400 to go through, or single payer to go through, because it's really painful for me to watch them. I mean, I notice when you make the argument for single payer healthcare, people say, well, why don't you get a job that offers benefits? There are a lot of full-time jobs out there that don't offer benefits for one reason or another. I don't know how they get around it, but it seems like a lot of dental offices are not offering benefits to their dental assistants or their front office workers. And, I had a friend, when he was first diagnosed with cancer, he had no medical benefits because his employer effed up. I had another friend working full-time as a security guard, couldn't get help. He didn't have benefits and he couldn't get treatment for his hernia. I mean, this is ridiculous. And Ashige, I want to tell you, I've been involved with the Democrats. I've been active in the party. It's just like Dr. Song says, they're going to say one thing. They're going to make you all these promises. They will make you all these promises and they do not follow through. So, you know, I see why Dr. Song feels the way he does. And I've called them a lot of stronger things, stronger than whore. So to their face, I don't care anymore because we're in a pandemic. We're in the second year of a pandemic. We should have had this yesterday.
Absolutely. Well, the problem is that the way the federal law and the state law is, if you have less than 50 employees, you're not responsible for providing healthcare benefits to your employees, and those people have to get coverage under the exchange. And you know, one of the things that Bernie and Pramila tried to do during the pandemic was to pass legislation that anyone that lost their employer-sponsored healthcare would immediately be enrolled in Medicare indefinitely. But the corporate Dems won out, and what they did was they said, no, we're not going to do that. We're just going to pay even more to let these people stay. We'll pay for their COBRA coverage so they continue to stay on their private insurance rather than just stick them on Medicare, which would have saved money. But this is really the problem we're up against.
Easy. And Michael.
Yeah, thank you, Dr. Song. I was wondering from your vantage point, you know, as you continue on the campaign to promote AB 1400 and doing just your great work around educating the community and various communities. I was wondering, you know, since we've kind of been down this road, you know, many times here in California and very recently, I think 2017 was the last time. What do you think has changed in the political landscape, if anything has changed, that might you know, produce a different result or outcome this time? I mean, I don't know what you know, how much political analysis you put into you know, where things are at, but I think that's really kind of the question, isn't it, at this point? Because there is this you know, great support behind a single payer, but we just can't get, as we've been pointing out, our Democratic you know, supermajority or the governor in this case to support this bill in a real way.
Great question. Well, thank you. So, you know, as somebody who's been now, I think, fighting for single payer for 15 plus years, I would say that it's changed a lot. So 15 years ago when I started, the only people that you would hear really speak about this were what I would call a bunch of white Berkeley hippie doctors. Now, and the support was for it. Very few people heard about it, and the support for it was quite low. I think Bernie running in 2016 put Medicare for all in the public consciousness. People started to say, what is that? And then now you started to see more people understand what Medicare for all is. And so the support for it from a public opinion standpoint is an all-time high. Having worked on marriage equality, which is something that was dear to my wife and I can also tell you that if you look at the curves of marriage equality, the public perception of marriage equality, up until the 4 or 5 years before that, there really wasn't that overwhelming support. And all of a sudden it went through the roof. And in much the same way if you look at the polling for single payer, it's very similar. And I think what happened was, just like some of my closest friends came out to their family members or to their coworkers or to their neighbors, and people put a face on these people as being just people they cared for, respected, and why shouldn't they have the same rights that I did? That's what I think is happening in healthcare. The more people hear about how the healthcare system's harmed somebody in their own family or themselves, or they start to share those stories, the more they realize this healthcare system is a fraud. We don't have the best healthcare system in the world that we all have been led to believe for all the years we were growing up. And so between politicians who can really speak to that, so Bernie, Pramila, still you have people like that. And then just people sort of coming out with their own healthcare horror stories, I think you're seeing the public perception change, and people are realizing they're paying all this money and they're not getting what they deserve. I think we have to just continue that. We have to build a groundswell in the grassroots. Unfortunately, I don't think we have like a real Bernie here in the state of California that can really energize our state the way Bernie did nationally. There are some really great assembly people, but they're not really known outside of their own districts. We don't have anyone on a statewide level that really is championing this. Dave Jones was when he was insurance commissioner, but you really didn't see many others. John Chung, who's a good friend of mine, really was not public in support for this. Betty E has not been public in support for this. Fiona Ma has not. I think we still need our own state Bernie to do this. But I do think that public opinion has changed dramatically, David, and I think it's only a matter of time before the masses will have a much bigger impact on how this moves forward.
Thank you. Michael.
So Dr. Song, thank you for that presentation. It's very informative in terms of like showing how the healthcare costs had risen in the last 3 decades. And I understand majority of doctors. I mean, that's great that more doctors are supporting it. My question is, what would it take to boycott the California state legislature, meaning replacing the older members with young people, and then you have older generation of doctors who still resist to Medicare-for-all, even though they're not members of PNHP. So how would you convince them, especially the surgeons and specialists who are not part of PNHP and they never heard of Medicare-for-all?
Oh, I think they've a great question. So you're seeing a generational shift. So, the California Medical Association, which is a very, very powerful lobby here in the state of California, the head of it is very close to Gavin Newsom, Dustin Corcoran. He's one of the people that was at the French Laundry dinner with the governor. If his membership is changing, so you used to have a predominantly white doctors that were treated like God, who were very conservative in their political ideology, and a lot of those guys are now retiring or have passed away. And now you have this new wave of physicians. Particularly, I speak to medical schools all the time right now because they're our future, and they are so alert and aware. They have never practiced in a system where doctors have been treated like gods. They're going into it for all the right reasons. They really are, and overwhelmingly support Medicare for all. So I'm very hopeful that the next wave of physicians that are coming in will the majority will be in favor of Medicare for all, because they think the insurance industry, they don't want to practice in a system where the insurance industry is too powerful or the hospital association is too powerful. So I think you're seeing a sea change happening in the medical community. As far as the older docs, and like Jim Wood, who's on the health committee, he's a dentist up in Northern California, very much thinks he's a Democrat, but he does everything to block Medicare for all. Richard Pan, another doctor up there. Those guys, you know what? They're aging out, and there's a whole new wave of amazing physicians that reflect the diversity of our state that are coming in, and I'm very hopeful and optimistic that they will become the predominant voice in the California Medical Association in the next 10 years.
Yes.
You're starting to see more and more doctors demand the CMA support it. And beginning, you weren't even allowed to bring a vote up. And now you're getting like 30-40% of the membership in favor of it. So I think just in another few years, you're going to see a majority of people supporting it.
Yeah, because I had a meeting today, because I just put this in the California Commission today. Dr. Richard Pan was discussing his concern about AB 1400 being implemented. He's concerned that once AB 1400 is implemented, because due to the Great Recession that your state had experienced, he's afraid, because in his experience, the legislature imposed a cap how many visits patients could visit their healthcare providers. So he was seeing like the financial implications and when he said, I'm like, no, because he couldn't distinguish between Medicaid and Medicare. Medicaid is welfare. So Medicaid and welfare gets cut, whereas Medicare and social program doesn't get cut. But nowadays members of Congress are finding ways. Joe Biden has privatized Medicaid, converted into a Medicare Advantage.
Yeah, so there are a lot of things there. I will say Richard Pan is full of shit. I'm just going to say it like
Sure,
that.
yeah.
And he is a puppet for the California Medical Association. He's always been. Secondly, while the country had a recession, California ran a $50 billion surplus, right? Or if I wasn't mistaken, $75 billion surplus. So if anything, that allowed them to expand Medicaid under a recession. And then the third thing I would say is, this whole idea that when you give everyone universal health care or Medicare for all, that it's going to increase utilization is strictly not true. A lot of conservatives like to say that now that you give insurance, they're going to go to the doctor every time. No, what happens is when everyone has insurance, they're going to get healthier. And in the long run, they're going to need healthcare less because they're going to spend a lot more time on preventative, and you're going to save money down the line because people don't have uncontrolled diabetes or blood pressure or all those issues. Right. So as I say, Pan is he's full of shit. I'm just going to leave it like that.
Oh, I understand, because I was frustrated with him today in the commission. He was addressing the implications for the healthcare workforce, and this was recent. He says he's from He's a Taiwanese. He's from Taiwan. He told me when he went with his wife to Taiwan, and yes, he knows that Taiwan has Medicare for all, similar to us, right? He noticed that there's not a lot of new, medical innovations in Taiwan. Majority of Taiwan, and when he said, I'm like, he doesn't understand because at least the Taiwanese people don't have to wait a line to see a specialist. Maybe they have to wait for technologies,
again, if he talks to other people that actually, of course, they didn't actually get an expert from Taiwan to speak on it. Because if they did, they would have told you that actually they're more advanced. They have the most advanced electronic medical record system.
They do, which I understand.
If you go into Taipei and then all of a sudden you end up in Tainan and they just swipe your card and all your records come up and they know right away and there's continuity of care. Second thing they would say is the number of Taiwanese, my mother-in-law is from Taiwan, the number of Taiwanese that actually go back to Taiwan to get their medical care. It's cheaper for them to get on a flight, go to Taiwan, get all of their checkups and medical care done in a year than it is for them to stay and get the care here in the United States. Those types of lies are just the type of crap that's the problem. He was appointed to that healthcare commission by Gavin Newsom. And, Gavin, who ran on being, I'm going to implement single payer, he stacked it full of, anti-single payer cronies that were all carefully pre-selected with Dustin Corcoran's approval from CMA. Right.
Yeah, because even the Taiwanese expert, he was on the commission. I was surprised that the Taiwanese commissioner did not offer rebuttal to Dr. Richard's parents' claim that people in Taiwan get inferior healthcare because I forgot what the Taiwanese expert. He was the one who implemented Medicaid single payer in Taiwan. I forgot to say.
It makes me so mad because I was actually nominated for that commission, but I found out that Dustin Corcoran didn't want me on that commission because what I would have told Richard Pan is, if you want to see crappy healthcare, go spend time in our inner city hospitals with the Medi-Cal patients. And, there's no innovation there. There's no anything there. Right. And this is what those guys champion as the progress that they've made.
Thank you. Taiji?
Sorry.
I was just going to ask, Save Our Seniors Network people, I was just going to ask them to share some of their experiences, and how they connect the work that they've done, to what we're talking about tonight.
Reggie, you have your hand up.
Sure. Dr. Song, did the SOS people tell you that a doctor really told Pacifica, hey, you can't move the seniors, and you can't move the seniors. It's really bad for them because they're like 90 to 100 years old, and it'll be really stressful for them. They did it anyways. And since the move, at least one senior that we know of has passed away. Right, David?
Yes.
Right, Taiji?
Yes.
Okay. So that's pretty, you're making like these really super old people who were in the internment camps, by the way, go through this traumatic thing. I kind of like two questions for you now because of this. it seems like the old school Asians, they're against single payer healthcare. But then you got people like Ash Carla and Alex Lee, they're for single payer healthcare. I don't know if they're Bernie, if they could be the next Bernie in California or not, but it looks like the Asian people need to have we need to have an Asian Bernie Sanders, because I'm hearing David and Taiji are telling me things like 1 in 4 Korean seniors has healthcare. I mean, like, so many Asian seniors lack healthcare.
Right.
And yet supposedly our culture is supposed to revere the seniors, revere our elders, but yet, we don't want to get them single payer healthcare and make sure that they can go to a doctor anytime they need to. And Carla and Lee, they wrote AB 1400. I hope they get to be the next Bernie Sanders. I really wish them well. Okay, so Taiji says 1 in 4 Koreans, 25% in US do not have healthcare
Yeah,
coverage.
but it's not seniors. It's 1 out of 4.
Sorry.
And actually, that was pre-ACA. It's dropped down to somewhere in the 12% right now. Koreans prior to the ACA of all Asians were some of the highest uninsured. I like Ash. I like Alex. I think they fight for all the right reasons. Among the Asians that are elected in Sacramento, I think they are the ones that really speak to the community. I feel like some of the others that have kind of they've waffled. But I do think that, with regard to what happened to the seniors there, that's unconscionable. And I think the fact that the governor, nobody from the Board of Supervisors could really put an injunction on it, that the mayor, all these people basically just sat on their hands, really is a slap to their own parents, because that's what essentially you have to look at. These people represented each of our parents or our grandparents, and it was really disgusting.
How do we make single payer? How do we convince the older generation that single payer is the way to go? And also, would single payer healthcare make things easier for caregivers as well, so we don't have to move the seniors out of their homes?
As I mentioned, there's long-term care coverage in that, which right now, as I said in some of the slides I showed earlier today, are desperately lacking. So yes, it would absolutely improve long-term coverage, and also do away with the copays and deductibles that seniors have. So if you're on Medicare Part B, that only covers 80% of your outpatient costs, and the remaining 20% has to come out of your pocket. And this is what's led to the privatization of Medicare. More and more seniors are going to Medicare Advantage plans to cover that 20%. You would do away with the need for all of that. So seniors would definitely come out better. And it's not just give everyone the existing Medicare that they have, but dramatically improve their own Medicare. Because Medicare right now that even like my mom has is not perfect, but it's better than Medi-Cal, and it's better than the private insurance that many of us have. But I think we need to do a better job of educating our seniors as to why this would be better for them and their families.
Michael, do you still have your hand up?
What Maureen's got her hand up.
Oh, okay. Go ahead, Maureen.
Hi, you were asking for some stories.
Yes.
Several years ago, I was at an event, and I can't remember what it was, but it was a healthcare, I think it was St. John Center down in Los Angeles. And I was sitting at a table with primarily Asian immigrant women who were, many of them, I would say, in their 60s, some in their 50s. And they were discussing how they didn't want to sign up for any kind of health care. They were going to forego getting any kind of insurance because they understood that they could lose their homes. And their home was all the wealth that they had to leave to their children. And they felt, we see that this medical debt and this healthcare system is one of the greatest transfers of wealth from the middle class to the wealthiest, to the banks, to the real estate industry. And these women were talking specifically about Medicaid. they didn't want to go onto Medicaid because there's this thing called estate recovery, which is after a person dies, if they received care through Medicaid, that their estate, after they've died, their estate can be billed for the care that was given. So there's a misconception that if you get care, you will, that somehow our tax dollars are taking care of that. It is momentarily, but then people are billed posthumously their estates. So this was a case where there was a table. I think there were probably 6 or 7 women at the table, and none of them wanted to get health insurance because of that fear. They would rather have their illnesses not cared for. They would rather die of their illnesses than lose the ability to pass everything they'd worked on their entire lives was in their homes, and to not be able to leave that to their children was something just completely unacceptable to them.
Yeah, thanks, Maureen. And, again, that just shows you again how blatantly racist our system is as well. You have these people with generational wealth who can do whatever they want to hide their assets to pass that on. And the majority of these individuals that are Medicaid are of color, and they're the first to own their homes. And now you're going to take it away from them because of their inability to guarantee healthcare to the way we should. It's really just, frankly, all of it's just so disgusting.
Michael, do you still have your hand up?
I just want to add, yes.
Go ahead.
Just want to add something what Reggie Wong said earlier, that what does it take to convince our parents and racism to support AB 1400 or even medicare-for-all, and understand that Asian parents, the older generation of Asians are more conservative than the younger ones. And I totally understand why, because when Asians came to this country, they had this mindset of the American dream. The American dream means be self-sufficient, be loyal to family, don't depend on anyone for assistance, right? It's like your friends, family, or government. So that mindset's still stuck to this day. But I totally understand where Reggie's coming. I totally understand her frustration, because I went through that frustration myself before when I had to convince my parents. And funny thing is that my parents are in healthcare, even though I don't manage a healthcare practice, but I had to educate my parents. It took my mom a while to understand, but she got it finally, because she handles billing. But my dad, on the other hand, and funny thing is that he's a doctor too, a urologist. It took him longer to process than what I had imagined, because I had to distinguish the difference between a single payer and socialized medicine. And so they finally got it. And to bring on this frustration, that because I understand, and it's what Maureen said earlier, because the reason why Asians it's not that the Asians don't trust the government. They don't trust the government because from the experience of Asia. They think of, like, especially Vietnam, other Asian countries, because of the C word, communism, you know what I mean? So when they hear the word communist, that means, oh my gosh, the government's gonna go after me. Oh, I'm gonna be put in prison if I get.
Michael, I will just push back. I know that's what the seniors feel, and maybe that's the way in the Vietnamese community. But I can tell you that both Korea and Taiwan have single-payer healthcare systems, and I don't think you hear the same. Again, the Asian community is not a monolith, and I think that we saw that the Vietnamese community was much more for Trump than the other Asian communities. I just think we have to do a better job of educating all seniors on why, even at this point in their lives, this would still be a better healthcare system for them than they have right now. I do know, like in Florida and places like that, where you had people flee Castro, Cuba, which ironically has a better healthcare system, I think, still, that people didn't want socialized medicine. But it's important to point out the booming countries that do have great healthcare. Korea, Japan has a robust healthcare system. It's not single payer, and then Taiwan. And I think we just need to educate people about that. But I find, like, seniors, if you're conservative, meaning just your ideology, Even the Koreans I know who are very strong in their church and conservative, you'll never hear them speak bad about the Korean healthcare system.
No, of course not.
So I think we just have to do a better job of speaking individually to seniors about how this would benefit them in positive ways. But I point taken. I think a lot of people that fled, my dad fled communist North Korea, so I get it. But he was in favor of single payer before he died,
Right.
and so I do think we can do that.
Thank you.
Thank you.
Taiji and then Maureen.
Be a shortcoming if we didn't more explicitly talk about AB 1400 related to the Save Our Seniors campaign. I was hoping other Save Our Seniors members would speak up, but apparently they don't have any questions or anything. Couple of things. We just lost Dr. Song. First of all, thanks for your joining us tonight. We just lost the only intermediate care facility in the United States that provides bilingual, bicultural healthcare services for Japanese American and Japanese seniors. There are no other facilities at that level of care that provide those services. We were fighting for a piece of legislation called Assembly Bill 279, which originated from this particular fight, but then it was extended to include seniors at all nursing facilities, licensed nursing care facilities in California, to halt evictions during the pandemic, at least until July 2022. That was the amendment where they termed it out, right? And also, it would have stopped major reductions in services at such facilities. We got 95% of the legislative vote behind that bill. I don't know how many of those people that voted yes knew that Governor Newsom was going to veto it so they could just look good during the floor votes, but the fact is there was bipartisan support for that bill in 4 committees and on both floors of the legislature, and the governor waited until the last minute, as people were going back to their districts before he vetoed it, making it pretty impossible for us to call a veto override. So my specific question is, and this is the reason why we held the event, I'm sorry to get to it so late, I should have probably busted in earlier on this, is that the Japanese community also has, amongst Asian Americans, probably the largest percentage of elderly. So this is like a pressing issue for many people on this call. That's going to be our next phase of life. Where are we going to go? And if it's an intermediate care facility, it's not going to be one that has, culturally appropriate services or staff. How does AB 1400 relate directly to this issue? That, I guess, I'll put that question on the floor.
So it all comes down to money. I hate to say it. The reason seniors are being discarded, the reason people are being relocated is because currently they probably can't afford the yearly cost to stay at a facility that would treat them better. Under AB 1400, as I pointed out earlier with the slide, in terms of what the average cost is to stay in a assisted living facility, skilled nursing facility, all those things, and how very few people can afford it. The majority of seniors right now are Medicaid, and Medicaid pays very, very little. It is very hard for these facilities to be profitable with what they're being reimbursed to take care of these seniors. So what do? They provide crappy care. They have one aide that takes care of a whole floor of seniors. And that's why when I've seen some of these places, seniors yelling for, hours on end trying to get someone to see them, the care at a lot of these places is horrible, let alone the fact that the seniors have to stay there. And why? It's because the reimbursement as it is right now, and I would guess the majority of the Asian seniors are on a Medi-Cal plan. It's very difficult for these facilities to not make a profit at the expense of care. So when they have a chance to kick these seniors out or to sell because they're not making money to a developer, that's what incentivizes them. So at its core, it's all about the rotten system that we have. If you were able to give a Medicare for all real benefit where these seniors have real coverage, so that the amount that the insurance company, or in this case, AB 1400, the state single payer system, would pay to rehab facilities or nursing facilities. First of all, most of the seniors wouldn't have to stay in the crappy places they're staying in right now. They could find a whole different level of a place to stay, more like these the tonier places you'll see in Beverly Hills or on the West Side. They wouldn't have to stay in these, I hate to say it, like flea motel places with very poor ratios that barely pass the scrutiny of a nursing home. But that's the reason they're really screwed, because they can't afford it themselves, and they've got a crappy ass Medicaid system that pays so little. So if you change that coverage in general, they don't have to stay at these crappy facilities, and they would not be worried to have to be worried about being kicked out of some place like that. They would be staying at a much higher level facility, and you would see more options available to all seniors.
Thank you. Any other questions and comments?
I mean, sorry to be so blunt, but that's what it really comes down to. The reason our Japanese seniors are being treated with such disrespect is because they're not viewed as patients or seniors. They're viewed as, what is the state paying me to take care of this patient each month? And it's so little that there's this resentment that's built up against these seniors through no fault of their own. And as a result, whenever there's a chance to get rid of them, they will.
One of the things that we found out in the struggle, Dr. Song and others, is that this outfit, Pacifica, has 41 nursing homes, apparently, in California. And every single one right now, with the exception of the 325 campus, which is the assisted living facility, it still takes 6 people Medi-Cal. None of them take Medi-Cal, none of them, of all 41. But many of them used to. Right. The ones that we visited said that, oh, they used to do that, but they phased them out. You know? And
the reason is, I hate to say it, it's not all the nursing home's fault. Mm-hmm. It's our state that it reimbursed so crappy that you can't afford to fill a facility with just all Medi-Cal patients. You can't. It's just impossible. And so as much as you have people that want to do it, the state has to change. And this is my point. When you just add more people on Medi-Cal, but you don't increase the reimbursement, you're not making the system. You may go to bed better. Oh, now this person's technically insured by Medi-Cal, but they're not getting coverage because nobody will see them. No nursing home will take them. No doctor will see them. No specialist will see them. And as sad as, as heartless as that may sound, if you just saw nothing but Medi-Cal patients, it's hard for any practice to survive in this day and age. Minimum wage, you've got to practice. If you have to pay, hopefully you're paying more than that, but the average reimbursement is so bad.
Right. It is.
So that's where AB 1400 was solved.
Right. It really, the way that things are set up now, don't you agree? It really breeds a lot of corruption, because many of the CEOs of the hospitals, I've seen a couple myself, because I used to, California Nurses Association, I was the National Assistant Director of Organizing. So I had to deal with some of these CEOs, and they're so angry, they're so angry that, these people do not realize that this is just another unfunded requirement. They're always angry about staffing legislation and anything that they have to pay more money for better healthcare. They're angry because they keep saying that we're getting ripped off. They feel like they're victims, big victims, like, they don't reimburse enough. And even though they make a lot of money, they think that they're victims. And so they continue to, and I know you know this, but everybody cheats on those DRGs. Everyone. I don't care who it is. All these hospitals, they all cheat, and they're all trying to get more back reimbursement. And so to me, what I've seen is that the corruption that comes from the system, a lot of it is because of the private nature of the system, I think. That's how it is. Shige, you have your hand up, and Maureen after.
think Maureen's before me.
Go ahead, Maureen.
Thank you. I don't need to be in line ahead or behind anybody, but thank you, Shige. Yeah, I wanted to just sort of feed off of what Dr. Song was saying, and the fact that we do have a caste system, we do have an apartheid system. It is pay to play. We do say some lives are worth more than others, and that depends on the amount of money they are paid. So what AB 1400 would do is remove the tiers, remove the tiered system, remove the caste system, because everyone, and I mean everyone, would be in one plan. The governor, my assembly person, you, me, an unhoused person, we would all have exactly the same access to exactly the same care. And when that happens, a lot of these problems are going to disappear, because when the governor and you are getting the same care, you can bet three things are going to happen. You will have everything you need. It will be well funded, and it will be high quality. The problem now, it's the corporate strategy is divide and conquer, right? Mm-hmm. And so when we have all these different silos of care, Medicare, and then Medicaid, and then Veterans Care, and then, all of these different categories, so to speak, someone will always be on the chopping block. Someone will always be getting budget cuts to advantage someone else. So if we're all in the same system, there will not be that pressure or that incentive to start cutting the budget of various of people, because any budget cut will be cutting the budget for everyone. So that's what we mean when we say everybody in, nobody out, and that all lives are equal. And we demand a system that codifies and establishes with no doubt that all lives are equal. And the only way to do that is to treat all lives as equal. And that's what AB 1400 does.
Thank you, Maureen. Shige-san.
Dr. Song, you said that we need Barney here. What do you think, Ted Lieu?
I think Ted's great. I think Ted has been a staunch fighter. I didn't like his Iran votes, but understanding the district he represents, I could understand some of that. But everything else, I think he's been very staunch in his role. I'm not sure he's going to come back from DC anytime soon. I think he's been a very good voice to have in Congress. But I think, Ted's been great. He's been supportive of medicare-for-all. We need to get, like Alex Padilla is going to be up for re-election soon. We need to make sure he's fully on board. He blocked Sheila Kuehl's bill when he was in the Senate here in the state of California before. So I think, I like Ted Lieu. I like Ted a lot. He's my congressman. I talk to him not as much as I used to, but still often. I had a 50th birthday event for him when he turned 52 years ago. I'm a big fan of his, but I don't think has any plans to come back and run statewide or really be involved in California.
I think my point is we need to create one. We're not going to wait for Bernie Sanders here. I think we need to create one.
I think there are some people, as I said, I think, it would be great. I don't see anyone really running statewide that has captured that yet. I'm hopeful one day.
We might have to suffice until we get a Bernie, huh? We meaning little people, bunch of little.
I will say this: even if we had one Bernie that had the traction in the state, we still have an overwhelming corporate influence in our, quote, democratic assembly.
Yeah. Dr. Song, what do you think about the idea of a bunch of people getting together and saying, hey, why don't we do fundraising and build our own nursing home, like a nonprofit nursing home, construct our own? And, what do you think about that idea? A lot of people are, they look at alternatives and go, yeah, this healthcare system is completely screwed up. Why don't we just withdraw from the whole thing and just do our own?
I mean, it would be wonderful to be able to set up a place where seniors could live with respect and dignity and be cared with love and compassion, regardless of cost. I worry if you build one and you're going to exclude so many seniors, because there's such a need, right? There's so many seniors that are facing that. I mean, I think one would be fantastic, but we need probably thousands, even here in the state of California, for that. But I do think, and then there's the regulation. So you might not want to call it a nursing home. You might just want to make it a community center for seniors, where the community can really come together and care and nurture these people who desperately deserve that. What broke my heart about what happened at Pacifica was, so my wife is doing a story specifically on survivors of the internment and all of what's happened there. And the things that many of us were not taught growing up in elementary school or even in high school or even in college, but to talk to some of these families. And I have many friends who grandparents or parents were interned, but to hear them have to go through just more harshness at this point in their lives, because chances are many of them experienced internment when they were very young. So you have the beginning in their lives and then have this trauma at the end. They deserve so much more than that.
Okay. Right now, I know that, Maureen, you put up some activities and opportunities for people to be involved. And I was wondering if you could just kind of briefly go through some of them, so that if people, want to, you have an hour or two to spare between now and January, because January is the big push, is it not? And
actually, this is the push.
Okay.
January is kind of end game, really. AB 1400 is going to have to pass 2 committees and the full assembly within 1 month, the month of January. So now is the time to put the pressure on. And we are focusing on the legislators, especially those in the Health and Appropriations committees. We need for them to pass this bill. There's been kind of a mislabeling of the bill as shelved. It has never been shelved. It is live. It will go straight to committee. It does not need to be reintroduced in January. So California Nurses is as a sort of full court press right now. And there are text banks. Very easy. I'm a tech phobe and I don't like phone calling and all that stuff, but I do it anyway. But this text bank is really easy. It's on your computer and the responses are all there. You're basically, you don't have to expend too much of your own brain power if you don't want to, but if you want to, you can. So there's texting, there's phone banking, Healthcare for All Los Angeles chapter. We are sponsoring a phone banking this Tuesday. It's a system, I don't know, I haven't done it yet. I'm going to do it for the first time on Tuesday, but I believe it is also a very user-friendly system for people who are, not that adept at a lot of tech things. But one of the interesting things about the phone banks is that we are going to be calling the 54,000 people in California who are already contacted by text and said that, yes, they were for this AB 1400 or for this kind of a plan. And yes, they wanted to be involved. So we are contacting, you're not going to be cold calling people who are really angry that you call them. Okay. You won't have as much hostility as you get when you're making those political phone calls. Right. So, and I know that really wears on some people. They just can't take it. But anyway, so we're doing that. There's another thing on our website, and I believe, thank you, David, I think you put the link in there, a letter to your legislature. You can do it right online. You just You can also go to our Healthcare for All Los Angeles chapter, healthcare-for-all losangeles.org, and where it says actions. And we have a whole toolkit with the phone banking, the texting, and then the letter. There's a letter that you can send electronically from your computer to your legislator, telling them that you want them to support AB 1400. We are also doing tabling. We have 3 weekly farmers markets tabling in Hollywood, at the Hollywood Farmers Market every Sunday from 8 in the morning till 1:30. These are all on our website as well. We have also South Pasadena, a member of PANA, Steve Gibson, has been fantastic setting up the South Pasadena, and I believe the other one is Altadena, that he has set up on Wednesday and Thursday evenings, and to inform people. Yes, our problem is the legislators. They have to vote. So we have to make them accountable. And the only way to make them accountable is to put some pressure on them and say, tell them what we want and tell them we are paying attention. And we are noticing when they are not on board, when they are not representing us. There is no excuse. California legislature is 75% Democrats in both the Senate and the Assembly. And we have a Democratic governor who campaigned on single payer, but forgot it instantly as soon as he was installed into office. So there's no excuse. So, and there's no excuse for us, because we can at the very least go in and click on that little button and send a letter to your legislator. But we'd love it if people would get more involved. There's also a postcard writing campaign as well. I'll put the links back in again, but there are many things that we can do just from your home on your own time. Or you can also get together and join in like a tabling. Oh, there's another project where you take your picture and they're making a huge banner of everybody's pictures to take to the assembly and have people's faces on it. You know, not only is this an urgent issue, but this is an issue about people's lives and people's deaths. And this is not a lightweight issue, just like AB 279 was not a lightweight issue. We are talking about life and death, and that should matter a lot more than some of these other bills. You go on some of these assembly members' websites and they're like, okay, you know, Persian bread day, Irish beer day, you know, I don't know, German, you know, sauerkraut day. I mean, you look at these one after the other and you think, is this the way they spend their time? This is what's on the website. It's rather depressing when we know 39 million people's ability to live well and to live good lives and to be as healthy as they could possibly be. That's what's on the line. That's what's on the line. And we are, as a country, #1 in the world among OECD nations, but actually #1 among first world nations in preventable death. That means we have people dying that if they lived in any other country, they wouldn't die. We are #1 in preventable disability. For instance, we have record numbers of diabetic amputations, which should not happen and don't happen in other countries because people get adequate, routine, regular care for their diabetes and they can control it. So we have foreclosures, we have people going bankrupt, we have entire communities that are losing their hospitals, losing their clinics because of this consolidation and this monopolization. So they don't even have access to any facilities in an area that they can get to. I mean, people are taking a bus. I used to work at a clinic in Venice, and we had moms arrive there with a couple of small kids, and they would have been on a bus for an hour and a half already just to get to the clinic for a little 15-minute appointment, right, for their child. And that's the state of affairs. So that's why we have healthcare deserts. That's, you know, one of the reasons we have healthcare deserts is because when it's all about money, we know the people people who don't have the money are going to be always on the budget chopping block. So I'm going to put those links in. I hope you will at least send the letter, sign up for the text bank, sign up for the phone bank. If you can, show up at the farmers markets. At least pressure your own legislator. Make a ledge visit. Get a few friends together and make an appointment. Show up at your assembly member's office. And we are concentrating on assembly right now because we have to get it through the assembly in January. It's too late to start, tomorrow. We have to start yesterday. All right. Thank you so
Maureen.
much.
Thank you so much. We have Lynn and Taiji, and then we're going to wrap it up because we're approaching, it's 10 minutes to 9 now. Lynn? Lynn, we can't hear you.
Oh, I thought sorry, I thought
Okay.
I'm sorry, I have it on my phone too. Anyway, I did texting and phone banking for AB 1400 this week, and it's all automatic. The phone banking is through talk, it's auto dialer, and the script is to try to get them to sign the petition and to contact their assembly member. So it's real easy. I did put one link, and Maureen will probably put it, but it only takes about an hour of your time.
Thank you. Taiji?
It's too late. It's too late to ask this, Dr. Song, but is there a reference we could share with people that are advocating the public option as like alternative to Medicare for all?
So I've given talks on that, showing what the difference is between Medicare for all and the public option. It's in the slide deck that I give up here. One slide on there, it shows the difference between the two. The one thing I will say, the public option isn't even coming up for vote. The insurance industry did a good job of killing it. You haven't heard anybody mention it in the first 2 years of the Biden administration right now, because the private insurance industry killed it. What they're all focused on right now is the privatization of Medicare through Medicare Advantage. You're seeing it in the generous subsidies that are being handed out. But public option isn't even something that's viable right now.
One other event on Saturday, December 11th, Saturday, December 11th at 2 p.m., Progressive Asian Network for Action, PANA, and other organizations, so far, Korean Resource Center, Thai Community Development, Thai CDC, they're on board. We're getting more organizations, but we're going to have a program. It's going to be called Free Bilingual Bicultural Healthcare with AB 1400. Be directed toward the Asian community, but everyone's welcome. And it will happen at 3300 Wilshire Boulevard, Emmanuel Presbyterian Church, on the corner of Wilshire and Berendel. So once again, 3300 Wilshire Boulevard, on the corner of Wilshire and Berendel, Saturday, December 11th at 2 p.m. And that will be a program called Bilingual Bicultural Healthcare with AB 1400. We hope that some of the SOS people can participate and speak about, our experiences as well. If you want to work on it, participate, please feel free to give me a ring, drop me a line. And I know that SOS, we may be discussing further how we might be able to contribute by doing a couple of tapings or something of that sort. But we have to discuss that in the future. Okay. Are there any other activities that either Maureen or Paul or others would know about? And also, if there's any other final comments and opinions, we welcome that.
Yes, David,
Yeah.
there is an event, there's going to be an event, and it'll be on our Healthcare for All LosAngeles.org website. And it's going to be December 7th.
Okay.
And Dr. Song will participate in that, as will I, and also Ryan Skolnick from California Nurses.
Good.
And it is an event put on by a union local from American Federation of Teachers. and it's put together by Julio Suja, and he is inviting all the staff and the faculty and students from the community colleges in the Los Angeles area. And he's hoping to get a few hundred people. So that is on our website, on our Facebook page. And also, if you're interested in getting our once a month newsletter, and then usually one update after that, we put out events. We put all the events around the AB 1400 issues. We put that out so that people can attend these things. So that's something to look out for. December 7th from 3 to 4:30 in the afternoon. And what's wonderful about it is that it's a teachers union, and we're pretty excited that that they reached out.
Thank you. People should know that this effort is a statewide effort. So like even in Los Angeles, with the African-American community, there are people who are doing this, and then the Latinx community as well. This is not just, Asians and a few other, this is like a pretty much a California statewide effort. Any other comments, any other final words? No, okay. Well, it's certainly been a pleasure, Dr. Song, having you on here, and thank you so much for your time. I think we all learned a lot and, got a bigger picture about what this is all about and how it fits into what we were doing. And hope that we'll see you out there in the whirlwind of activism, I hope, and that we will all be able to celebrate another victory, maybe sometime soon. So thank you, everyone. Bye.
Thank you so much. Thank you.
Be well.
Bye, everybody.
Bye.
Thank you.